So this video shows chest tube insertion in a patient post-operatively. It's a sterile procedure, so you have to be fully gowned and masked with a cape. You should always set your instruments before the procedure begins, and these are the instruments that you will need for this procedure. You can talk to your theater in charge to just get for you an instrument you need. So you have to prep the area. You can use any product that's available locally. Here we're using iodine to prep the area. Draping, you have to drape adequately and only expose a small part that you'll be working with. Then identifying the space, we usually use the fifth intercostal space. So you can just drop a line from the nipple, and the first space you meet usually is the space that you will be entering, but you can also count from the manubrial sternal junction, and that will help you get to the space that you need. So it's important for you to first raise a wheel just under the skin so that you anesthetize the area as that you will be cutting first, and then you can infiltrate the deeper layers to increase the effect of the local anesthesia. So sometimes as you're giving the local anesthesia, you will aspirate what is in the pleural cavity, and that also further tells you that you are in the right space to drain the collection in the chest. So you continue infiltrating the deeper layers and also in between the ribs, and also try and aim for the intercostal muscles. So give the lignocaine time to work. About 1 minute is enough. Then you test and see. So you can see there's no reaction in the patient's face when we pinch in the area that's anesthetized. It's important to have the chest tube ready. Always make sure you secure the connector, because without this you cannot connect to the underwater seal bottle. So once you have your chest tube ready, it prevents you from having whatever is in the chest pour all over your operation site because of the high pressure, or just even creating an unnecessary pneumothorax. So usually I'll connect the connector to the tube and then clamp it so that I don't have the tube open to the atmosphere when I insert the tube in the patient's chest. So we've tested, and now we're going to make the incision. Should be about 1 centimeter or maximum 1.5 centimeters, and we cut only through the skin and subcutaneous tissue, as you see. So the dissection is blunt, and use your finger to guide you to know how deep you have gone, and always aiming to be in between two ribs. So keep dissecting further and using your finger to guide you so that you don't suddenly enter the chest without knowing. So you keep dissecting bluntly, and then use your finger to assess how far you have gone. So you keep the dissection, and then you will feel, once you're almost near, you'll feel that the tissue has reduced, and then you can safely go in between the ribs and into the pleural space. So again, your finger will help you know how deep you've gone. Okay. Keep assessing so that you don't suddenly enter the chest. So once you're in the chest, you will notice there's drainage of blood from the incision, and that is you have entered the chest. So at this point, prepare your chest tube. Use your forceps to make the tube stiff so that you can enter in between the ribs safely, and then the tube goes in and the forceps comes outside, so you don't put the forceps into the patient's chest. Then you secure the tube in place with your stitch. Connect the tube to the underwater seal. Make sure it's tight, and then whatever is in the chest will come out. If it's a pneumothorax, you will see bubbles in the underwater seal bottle. and if it's blood, you will see that in the bottle as well. So make sure there's a swing in the tubing. So then you secure, make sure it's an airtight dressing, because sometimes you can have air passing at the side of the tube and into the chest, and then you end up with a pneumothorax. So make sure it's an airtight dressing. You can see the dressings are overlapping. And then to reduce the pain for the patient, you can secure the tube to the patient's chest wall using what we call a memento tag. And this will make the patient more comfortable during the duration that the chest tube is in. And there you have inserted your chest tube.